Until now, we were talking about problems. Let's talk a little about solutions. And sex therapy can offer to you today many, many alternatives. So I will share with you what we do in our sex medicine center. And we are not genius. I mean, it is normally done in many places in the world. And usually what we do, we work on a few levels. The first level, you remember sexuality? We were talking about the touching aspect and the emotional aspect and communicating and sharing. So the first one has to do with touching. It is called sensate focus, meaning focusing on your senses. What do? Actually, we ask a couple to go home and start doing their turns on touching one another slowly and learning what is nice, what you like and what you don't like. And the touching is not sexual. The touching starts from neutral areas, like your back, like your hands, like your face. And what do? We do a new mapping of the body. It is very interesting, because sometimes we don't do this mapping since the age of 20 when we start having sex, and we forget that our body changes. With the change of age and the change of hormones, the skin in our body and the areas and the levels of pleasure changes. Some people lose the ability to touch in some areas, and some people get more sensitive, and the touch should accommodate to the changes that happen. And if we are older, let's say during our menopause or even later, in later years, really the skin changes. And this mapping has a purpose. And the purpose is first that I will learn when someone, like my partner, touches me, that I will learn again. I'll do a relearning process of the places, the areas that I enjoy. But it's not only the touching, it's also communicating. Because when touching, I have to tell more or less, stronger or softer, quicker or slower. And this is something people do not know to do. Because we can give remarks to one another, communicate on simple stuff like the coffee you gave me, there is not enough sugar, or maybe the doctor told me that I cannot use sugar anymore, so I can tell you, give me a sweetener. When it comes to food, we give the remarks, we communicate, we tell one another if it is good or not, or if something should be changed. But when it comes to our body, we close our mouths. For 30 years, we get the same touch and we don't like it. So this is a relearning process. So sometimes the Parkinson is a good opportunity to start, and it is very good that you go for counseling and you experience it, because this touching relaxes you. And this touching sometimes is for some couple the first opportunity to touch one another. Because what happens? Many people have sexual problems, which is really frequent. Not only to people with Parkinson, everybody. I mean, in the society we have many people with problems in their sexual functioning. But the main problem is that most of the people combine the touching to the sexuality. I mean, the moment they start touching one another, they proceed to the next step, and the next step is having sex. And when they can't have sex, then they can't have nothing, because why touch if you cannot use it to the end? So you stop touching. So for some of the couples with Parkinson, and some of the people who are watching this, who are watching me, it is important for you to start touching, but very relaxing, in a very relaxing atmosphere, because you know that you don't have to have sex now. You just learn the touching process. One of you learns how to touch and the other one learns how to get it. Now, for some of you people with Parkinson, maybe you cannot touch with your hands because maybe your hands is trembling too much. Use something. Take a glove. Maybe take fur, piece of cloth, fur, or take something, silk, something nice, or take a sponge. Take something and use the something, a brush, feathers, whatever. It's not important. Just relearn how to touch in a pleasurable way. So this is the first part. And it is important because it also increases our capability to be sexually functioning. So we are getting a better communication, a better touching, a very nice experience, not threatening, nobody fails there, and something which increases your abilities. This is the first level of sexual intervention, which in every sex therapy clinic they should offer you it. Then we move to the second part, and the second part is continuing with this sensate focus to Venice. What is Venice? This is an abbreviation to a very erotic, non-insertive sex. Means it is focusing on your erotic parts, letting you learn how you get each other become aroused, but you learn it, and it is really nice, but you don't come to orgasm. I mean, if orgasm comes, sneaks in, okay, nothing happened, but it's not the purpose. I mean, we are not staying on one area and focusing there until we reach orgasm. The idea is learning. And it is also a very nice experience. And then we continue to the third step. And the third step is teaching people how to have sex in two versions. The intercourse, which most of people know, meaning you have to get a proper erection, you have to get a relaxed and lubricated vagina, and to combine them together until you reach orgasm. This is the way that everybody is instructed from childhood or adolescence. But we have another sexual activity which is very pleasurable, very nice, and not that anxiety creating, and this is called outer course. You hear the out, meaning nobody enters in, meaning the penis does not penetrate the vagina. And you can do outer course on every level that we talked about it before. You can just stay caressing one another and enjoy it. And then you can move into more erotic caressing, like the Venice. And then you can even caress one another or stimulate one another to orgasm. If only one of you likes it, go for it, and the other one doesn't have to reach orgasm. Or if you can't reach orgasm, one of you can enjoy the excitement until orgasm, and the other one only will stay aroused. And every step is so nice. And the combination of all these levels actually offers, I would say, the best package deal in sexuality that you can have, with the best sexual insurance, because you can do it until you are 120 years old. So these are the solutions that we have today. And if we need, we combine them with medications, like the medication for erections or for lubrication or some hormonal medication. But this depends on the evaluation that we do. And usually when we do the sex therapy service in our clinic, we use a multi-professional staff, meaning sex therapists, which are usually psychologists or social workers specializing in sex therapy, together with urologists, together with gynecologists who specialize in treating sexual dysfunction. And all the staff will do the diagnosis and the intervention according to the need.